Hey everyone, this is Caesar from AltaView, and I'm going to take a question today about shoulder impingement pain. So basically the first thing to understand about shoulder impingement, the diagnosis, is that it's a little bit of kind of a garbage diagnosis. It's very generalized. Essentially, it's a blanket term for pain in an area that's being squeezed. And if you think about it for a moment, why else would you have pain in an area if you weren't squeezing something together, right? So if you take something, even your finger, and you just take it to a certain point and there's a pinch in the area and you push onto that pinch, it's going to hurt, right? So that's a type of an impingement. You could have an impingement anywhere. You can have it in your shoulder, in your hip, in your elbow. So impingement is basically another way of saying pinch pain. So why does your shoulder hurt? Because it's getting pinched. Well, what's getting pinched inside your shoulder? That's a more appropriate diagnosis. Like, for example, you have a rotator cuff problem, you have a biceps problem, you have some sort of a labrum problem with a little ligaments inside your shoulder. You know, they might be pinching something, producing pain. So just remember, shoulder impingement is basically just a preliminary blanket diagnosis for a real more specific diagnosis hidden underneath. So today I'm going to show you a couple of exercises that may help with shoulder impingement if it's due to problems in the subscapularis. The subscapularis is one of the rotator cuff muscles. It's located really deep inside your shoulder on the underside of the shoulder blade. And when that muscle gets very tight, it actually holds your shoulder down so that when you try to lift it, it's difficult and it starts to pinch. So remember, these exercises that I show you, they're just general guideline exercises. You really have to have someone properly evaluate you to determine if it's right for you. But maybe it will work and help you. You be your best judge. So we're going to go into the treatment room now, and I'm going to show you these exercises. Get the lab coat off here, get more at home. All right. So the big thing with shoulder impingement, as you lift your arm up, it's going to start to hurt. Sometimes it hurts up in the front, sometimes it hurts out in the back. Regardless of the case, with a subscapularis problem with your rotator cuff impingement, you sometimes will feel pain deep underneath your armpit, like almost feels like it's in your armpit or where the lat muscle is on the side, but it's kind of deeper towards the back. If that's very sore and you could press your finger there, that's the subscapularis muscle. So a lot of times when people have pain, they don't really want to raise their arm up, it hurts, and they instinctively guard it. They keep it closer to their body. You may yourself not even realize that you're doing it. You might feel, oh, I don't guard my arm. I don't like hold it like this when I walk around. But your brain actually is guarding it because it knows when it goes up, it's going to hurt. So it just holds a little bit of tension inside this area here where the subscapularis muscle is to prevent it from rising up nice and smoothly. So the subscapularis muscle actually does this motion. It actually brings your arm inward, almost as if you were on a sling, right? So this position here is kind of like a guarded sling position. So that's exactly what the subscapularis muscle does. It brings your arm inward. Now, it is normal for smooth operational movement of your shoulder, but if you have pain and it overreacts, then it's going to produce dysfunction, which is going to exacerbate the lifting of your arm and that impingement syndrome that you have. So one of the ways that you can tell if it's a subscapularis based problem is, like I said, you're putting your finger deep, right, not exactly in your armpit, but just below it and back towards your shoulder blade. And that might be very, very sore. So you're kind of gripping your shoulder blade with your thumb. Another test you could do is if you realize at this position you try to bring your arm out to the side and it's very, very stiff compared to the other side. So maybe my normal side, would be something like this. It goes out smoothly all the way, but then my injured side here, you go out and it gets very tight right around there. But then when you move it higher to this position, you find, oh, I can now go all the way out. And that just has to do with the alignment of the subscapularis muscle. So in this position, it's not really very tight, so you're allowed to move comfortably. But when you come down here, it tenses up a little bit more. Its length tension characteristic is shorter. So you actually see more obvious restriction at that level. So let's assume that there's some sort of subscapularis tongue twister problem that you got going here. I'm going to show you the first thing, which is a deep massage technique to try to release that muscle. So what we can use is like a lacrosse ball, something like this, or you can use a squishier ball if it's too sensitive for you. I have some patients use, you could use like a kiwi or a grapefruit or some kind of food item that's rigid if it's cheaper for you than going out and buying all these like, you know, fancy gizmos and whatnot. Some of them have little prickles on it. It doesn't really matter. The most important thing is that it's appropriate density, like thickness for you, so that you can actually get a release of that muscle. Just make sure, like if you're using a kiwi, it's not going to explode on you or something while you're exercising. So anyway, let's just say that we have this firm lacrosse ball type thing. We're going to use this to release the subscapularis muscle. So you take your, you could just say that, for example, you're lying on a yoga mat. I'll just do this treatment table because it's more convenient for you to see. But we're going to lie on the side like this. And the ball is going to go right in that area that's sore. So you're going to lie on it, making sure that it has a good spot here. And you're going to lie in that position like this, and you could have something for your head like a pillow so you don't strain your neck, because it's going to be hard on your neck to hold it the whole time. And you find that position, and you're going to feel it's very, very, very sore, and your tendency is going to be to come off of that like this. But I want you to just try to relax as best as you can onto it. Breathe in through your nose, out through your mouth, and just try to relax. And as you exhale, you want to sink deeper and deeper and deeper into the stretch. It's a different type of stretch. It's like a muscle release. What's actually happening here is that the pressure is stimulating the nerve fibers inside the muscle with additional force. And that force is sending a signal through your spinal cord and is saying to the muscle, you have too much force, too much tension. You try to relax now. Don't accumulate too much tension. It's like a kind of a reflex. And so that's what they call like the muscle spindle response. It's the muscle spindle is the part of the inside of the muscle, the nerve receptor, that actually senses that that stretching effect. So as the ball is pressing inside, it's adding force and a very deep kind of stretch inside the muscle fiber, and it senses that. It's telling a reflex to let it go. So the more you can relax and let it go, the more inhibited that spastic muscle will become, the more relaxed it will become. So you can do this for about 30 seconds to 2 minutes or whatever. I mean, everyone always gives some sort of numerical parameter like 30 seconds, or who cares, really. The most important thing is that you get a deep stretch. You might be able to get a great stretch in 15 seconds. Some people it takes 5 to 10 minutes, whatever. It all has to do with your level of relaxation, really. That's the most important thing. So you're just exhaling, you're feeling that pressure. You should feel, if it's a good muscle release, you should feel that the muscle is actually responding to the pressure with less pain, and you should feel more of like just the push of the ball. So it should become less tense and achy and painful, and more just like pressure of the ball. And if that's the case, then your muscle has essentially released from that tension. So let's say you completed that, and then you come on up like this. You should test your shoulder, see if you have improved movement, raising upward. And then you could also test out to the side like this. A positive result would simply be it's less painful in your arm. Remember, this is just one component of a very perhaps complex system of parts that would contribute to shoulder impingement, a very general blanketed diagnosis. So you'd really have to have proper evaluation by a sports orthopedic doctor or a physical therapist to determine what's the root cause, But this manifestation with the subscapularis is an important component to help in treating that type of a problem. So I hope this was helpful. You can submit any questions to our website, www.altaview.com, or just email me directly or type in your comments here below on YouTube, and we can look at the next question next week and address that. Okay, folks, I'll see you later.